Medical Center in Richmond, Virginia. He's a United States Air Force veteran and is currently working for the Department of Veterans Affairs at McGuire, Virginia Medical Center in Richmond. As the lead health educator in the Rural Health Incentive Program, Mr. Pond considers it to be an honor and a privilege to enhance veterans' access to health care and to assist them with managing their health and wellness. The Rural Health Team assists our rural veterans with registration, determine enrollment eligibility into the Virginia health care system, and provide health promotion and disease prevention education. Mr. Pond also develops partnerships and collaborates with community resources to reach out and better serve our rural veterans. So we're very fortunate to have him speak to us today, and I'm sure we heard a lot of good, interesting facts and services that's provided, and people that we know that we can help spread the word to as well. Mr. Pond, I'm going to turn it over to you.
Good afternoon, and thank you for having me today. I appreciate it very much. And before I get started, I just want to say that we do have a community-based outpatient clinic here in the Emporia area. And it's an outpatient facility that reaches out to our veterans, so we do have that location nearby. It's in the area. Did everybody know about that, or is it well publicized? I hope it is. Okay, very good. Okay, I just want to talk a little bit about and give a little background, first of all, about the McGuire VA Medical Center. This is an aerial view. We're actually the second largest facility in the state of Virginia, behind the Pentagon. It's a massive place if you've ever been there. It's truly a very large facility, and we have a lot of different services available. Now, I kind of like to walk around a little bit, so can everybody hear me? Okay, great. I like to make it more personal and that kind of thing. I want to give you a little background as to how the Department of Veterans Affairs is set up. It's a department that's comprised of three areas. One area is the benefits administration. The other one is the health administration, which is what we are obviously part of. And then the National Cemetery Association. So three parts make up the Department of Veterans Affairs. Now, I just want to talk about basically the Veterans Health Administration. Now, it's made up of what they call VISNs. We have acronyms for everything, government. And a VISN is the Veterans Integrated Service Network. There's 21 VISNs that make up the Veterans Health Administration. We are VISN 6. It's called the Mid-Atlantic. Now, within VISN 6, we have 8 medical centers. And they're located in Virginia, obviously, North Carolina, and also we have one location in West Virginia. So that kind of gives you a little background on how we're organized. It's a massive department. And I do have a little bit of information about some of the benefits, too. I have a handout and some websites, and I actually have a benefits overview that you're certainly welcome to take with you if you'd like. And at a later date, if you need me to come back, I can bring a benefits person that can address a lot of those areas as well. And this just kind of breaks down our area in terms of the demographics of where we're at. So in Virginia, we have 3 medical centers, one in West Virginia, like I mentioned, and then we have 4 in North Carolina. And each one of those has different medical centers that comprise the visit. Now, what I want to talk about today is I want to go over a brief program description, and then I want to talk about how we form community partnerships, and then who our key stakeholders are, and talk a little bit about health promotion, disease prevention, because really that's my area of expertise, and that's what I develop education programs and hold educational sessions for our veterans to help them be more responsible for their health care and take a more active role. And then finally, I'll have some web resources to look at, and I want to talk just briefly. We have a couple of mobile vans that actually go out into the community as well. So we're excited about having that equipment available. in terms of the program description, just kind of the basics, what we are is an outreach program, and we reach out to the veterans in the rural community. Our catchment area is huge. It's all the way up past Charlottesville, down past the border just a little bit here in North Carolina, and then let's see if I get back here maybe a little better here. I can show you. And then almost over, well, yeah, actually over to Lynchburg, and then there's that Hampton VA Medical Center as well. And so we kind of share our catchment areas a bit, so there is a little bit of overlap there. Now, in terms of the health education and disease management, what I'll do is just let me go forward here just a minute. I apologize for that. The primary areas for that is we break it down into women's health, mental hygiene, and health education. So that's kind of the major focuses of our health education program. And what we do in terms of women's health, my colleague, Theo Collins, she's a nurse, and actually she was going to come today, but there's an emergency situation for her, so she wasn't able to come today. And she helps me with the education piece. For the women, like breast self-exams, we talk about osteoporosis, and then PAP education as well. And then in terms of mental hygiene, a big part of what we do is PTSD, post-traumatic stress disorder. And I've been in contact with an author of a book called Tears of a Warrior, and Tony Sehorn and his wife have written a book, and I'm trying to do through VTEL, which is like a telecommunication device. It's actually, he lives in Wyoming, around that area. So broadcast with us in Richmond, and the C-Box, like in Emporia, Charlottesville, and Fredericksburg, and actually lead some PTSD sessions. I think that'd be very, it would be a good thing because the veterans can relate because he went through Vietnam, and he talks about his story, and then his wife, the co-author, talks about living with someone with PTSD. So, Tony Sehorn is a great guy. And then also in terms of mental hygiene, we look at, we talk to folks about depression, addiction, and suicide awareness. So that's another big piece of our program in terms of health promotion, disease prevention. And then finally, my area in health education, what we really want to focus on is the three major medical factors, and that would be hypertension, high blood pressure, high cholesterol, and diabetes. In addition to smoking cessation and healthy lifestyles and weight management, that type of thing. So I really focus on those, and what we try to do is capture the data to show, okay, what is the efficacy of our program? Are we reaching any outcomes when we engage these veterans? So we get a baseline in terms of if they were diabetic, maybe A1C and their blood sugars, and then we track them throughout, say, maybe 6 months. And then what is their A1C later on? An A1C is just a blood test that shows the average of the blood sugar for the prior 3 months. Health-Wise for Life, that's a book that we give to every enrolled veteran, and it's a guidebook that helps the veteran gain access to more health information. Because the premise is we want them to be an active partner in their health care. So Health-Wise for Life, it's a nice guidebook. We give it to all the veterans. My Healthy Vet is an online program. The vets can check online, and they can track their vital signs, appointments, their military history. It's a wonderful program. So the health education, mental hygiene, and women's health is the part of our health promotion. I'm just going to go back just a second. All right, investing physicals, all that is when we check, I have program support folks. And when they determine the veteran's eligibility, which is based on length of service, type of discharge, that's primarily the two main things, and the means test. And then once we find out they're eligible, then we do a physical, and that gets them loaded into our system, and that's done by a healthcare provider. So that's a big part of what we do in terms of our program is the vesting physicals. And then another part that we do is support our C-Boxes, community-based outpatient centers, in Emporia, Charlottesville, and right now Fredericksburg. So that's the 3 we have that's attached to our VA Medical Center. In terms of how we develop our community partnerships, last year I met with Commissioner Broadway, and we had a talk with him to say, okay, we'd like to go out to our VECs, and we want to talk with our veteran representatives and just initiate a dialogue and find out how we can reach these veterans. It might seem kind of easy to engage our veterans in the rural community, but they're pretty well hidden. So any way that we can find to get to those veterans is we're going to do that. Community service board is another area that we can look at, and I really haven't fully evolved that dialogue yet, but I intend to do that. And then local health departments, Dr. Wakeham, I met with her, and we had a dialogue. And what's important is the economy of scale here. We have so many resources available because of the federal government. So obviously economic times are very, very tight. So we can have a very good collaboration between the VA and between the businesses. That's what we hope to do, and actually really engage those veterans. And then part of what I do too, like I said before, is do the education sessions, and I'll do those anywhere. If you, at your businesses, if you feel like it would benefit for us to come out and do a class on high blood pressure or diabetes or cholesterol, we'd certainly be welcome to do that. And I've made presentations to colleges. I met with the chancellor for all the community colleges in Virginia, and again, they have a veteran representative, usually a student there. And so we just try to, any way we can do it, we try to reach those veterans in their rural community. And obviously, VFWs and American Legions, we'll go to state conferences and that type of thing. Okay, who are our key stakeholders? Well, obviously, it's the veterans and their families. Vision 6. So this is a very, it's a very political type of position as well, because our vision level is analogous to like corporate administration. So we have a lot of different areas that we are engaged in. So Vision 6 is one of our partners. Obviously, our medical center leadership is part who we are responsible to meet with. And then the service organizations like the VFWs and American Legion. And here, community hospitals. And what we want to do is we want to be seen as a partner and not as competitive. That's a very important point to make. So, again, use our resources and we can help. I did a presentation with the Virginia Rural Health Association Conference in Stanton a few months back, and my colleague, Chaplain Cook, she was a co-presenter, and so she is getting involved with developing a network with the churches so we can have maybe like a regional meeting with some of the different area churches and get 3 or 4 together and then present that way. So any way that we can have efficient allocation of our resources is what we're looking to do. And then finally, state agencies as well. Okay, we already talked about this. All right, what I have, you're welcome to, I can make some copies for everybody as well. I have resources printed here, and they're national and state government resources, medical information for veterans, Veterans Benefit Administration, education is a big piece that vets are interested in, and employment, different websites for that. And then finally, I have veteran service organizations like AMVETS, VFWs, Disabled American Vets, American Legion, etc. So if anybody's interested in that, I can make some copies for you there for your folks. And then we're connected, just like all the kids. I don't know how to access half of it, but my children do. You know, it's like, duh, Dad, you don't know how to do this kind of stuff, you know? But so we have our blogs and Twitter and all that type of thing. And then finally, our mobile vans. We're very excited. We have 2 different mobile vans, and the first one is very large, and it actually goes out to Farmville now and Crew, and they're doing physical exams out there right now. And the smaller van that we have, the 28-foot van, is we're fitting it now where we'll be able to do that as well. So I've been in contact with the VEC, with Farrell Thomas, and we can go out and do education sessions or whatever is best for the agency. Any questions or comments? Yes, sir.
What type of services does a veteran get at our local outpatient?
Very good. Okay. I passed out a handout of the benefits to the veterans at the employee CBOT. And underneath the services, primary care is one of them. They have lab services there. Mental health, they have a psychologist on staff, social worker, pharmacotherapy, so they have a pharmacy there as well, and anticoagulants, so if somebody is on like Coumadin, they can monitor that as well. And teleretinal imaging, so it's got quite a few services there. Now for more comprehensive, somebody would have to come to the McGuire Medical Center. And in this brochure, they're a little verbose on things here. We're going to do a few more bullet points, but it talks about everything there. They can do a financial assessment, and it talks about telephone care. So they have they have nurses line as well. And then on the second to the last page, it talks about My Healthy Vet that I mentioned earlier, the online program. And if you have a computer at home and you're online, you can access that. And then all the staff is on the back here with their contact information as well.
If you want to find out if you're eligible, what on your stuff?
And the first place to start would be, what I can do is, if anybody's interested and wants to find out, let me get your name, and then when I go back, I can check with our program support person, have them give you a call and get in touch. But the way you would do it is benefits, there's a form called a 1010 Easy form. Well, it's called an easy form, but it's about 6 pages long. That's kind of the way it works, you know. Anyway, Charles, our program person, can really help you navigate through that the form. So the 1010 Easy form is what determines your eligibility. Anybody else? Any other questions?
There's a representative that comes through the library on Thursday here in Emporia.
Okay.
For the veterans, because I run an assisted living home, Bloom Center, and I have some clients that have, as they've used their money to live with Bloom, maybe their money's getting low, and then I have gotten this article I'd seen on the veterans that you could apply for aid for like a wife of a person that's fought in a war or something, and they have gotten over, I mean, I know one of my ladies got over $1,200 a month to help her be able to continue to live in the same room she was in. Once her, and just recently I have another case that's just, they started back in June. They just found out they got it. It takes a while now, so, it would have been better this person had started a little earlier. Now, you find this out, but I've just found out in the last 3 years is I've had this living in the Richmond Time Dispensary with veterans and about aid to families. And so I share it with them. And this lady comes to the library with me Tuesday and Thursday, but I've got a number. And I call and find it, and you can go talk to me. She'll help you fill that form out, too.
Yeah, there is.
She's really nice about filling forms out. I mean, because the forms are unreal to do, and she'll give you her number, and you can talk with her. But and I mean, it does work, but it just takes a little bit of time.
There is another program. We all have collateral duties in there, so I do another hat I put on, and it's called the Caregiver Support Program. That might be kind of what you're talking about there. And I actually go out and I do a in-home nursing assessment when I go out and determine their eligibility. And then I work with Darlene Dameron, a social worker, and they do get a stipend for taking care of the veteran. Typically, it's someone that has a TBI, a traumatic brain injury.
Now, these people, they end up getting, they get their family have served. They have to serve. What I understand, they have to have served in a war.
Is it 8 and
8
10?
and 10.
Oh, okay.
Exactly. That's
Oh,
what
okay.
it is, 8 and 10.
Yeah, and they have another program that's just starting, and it's a medical home model. Jim McDonald is a social worker in charge of that.
You know, the only thing I find a problem is when mine do go to the veterans here, I have a hard time finding that same doctor that saw him that day, the next time, to sign something if he doesn't sign everything right. That's the only thing I have a problem with. If they don't sign everything perfect, you can't find that man again. It's like he disappears. And a new one comes.
That's at the medical center that we do have an affiliation with MCV, so there are residents coming in all the time.
I said, I never can find the same John.
But there should be fairly consistent at the
Yeah.
CBOC here. That's fine. Any other questions? Or? Well, thank you very much. I appreciate it.